I think for the large part, historically at least, healthcare has been largely inefficient. Um, Patients or guests come, they wait in the hospital for a long period of time. They wait for the doctor, they wait for their lab test or lab results, they wait for other diagnostics to be done. And so that's a great dissatisfier for our guests. And I think technology is being used to expedite things, make it a seamless patient experience, patient journey through the visit, whether it's to a hospital or to a medical center. Also, technology is being brought to bring healthcare to the community or bring healthcare into your home with telemedicine and teleconsultations, and even to the extent of having tele ICU and having patients in the home ICU type of setting. So that's one aspect of it, using technology to improve the patient experience. I think there's also a very opposite aspect of it in terms of how can we use technology to improve physician workflow. Sometimes we have a tendency to take who we're expecting to be the most productive person in the hospital, one of the physicians, we would like them to focus their time on patient care, but sometimes we pile things on them that are inefficient in terms of the insurance documentation and things like that, which are all necessary aspects of healthcare. However, I think it can be done more efficiently with greater use of the physician, or less, time spent by the physician on paperwork and more time on clinical care. So we need to see how we can use technology to make the physician's journey through their day efficient as well. And so those are some of the things that we're doing. Let's improve the guest experience, but let's also improve the physician satisfaction with their job. The clinical decision support, and if we can get clinical decision support integrated into the physician workflow, that is what helps, the most in terms of standardizing care. So that integration is an important aspect, and is can be challenging at the same time. So yes, if I have clinical decision support, I may use, I may, as a physician, uh, if I have time, look up something that I have a question about. But if a patient is directly in front of me, I'm not going to have the time. And that's the point of care. So that's the time that I'm entering orders, and I'm, delivering that care. So it's important for that integration. So the patient and the technology and the clinical decision support are all there together. So if I can get, the clinical protocols, the guidelines, the templates, and everything accessible to me right when I'm in front of the patient, that's what helps really standardize the care. And as a healthcare organization, helps me monitor whether physicians across a specialty are following those guidelines, are following those clinical protocols. When you have it on paper, or when you're doing it, auditing kind of after the fact, yes, you can do it, but it's not in this day and age as effective as when everything's integrated. You're measuring it while you go along. If a clinical protocol is not being followed, it can be highlighted then and there. And the protocols are just that. Protocols and guidelines are just that, they're guidelines. There may be cases in which we need to go away from the clinical guidelines based on a specific clinical scenario. but at least it's right there in front of us, and we're knowingly making that change in the management for this particular patient. So ideally, I would like all that visible to me, and as a doctor, and that's what makes it easier. And as an administrator, that's what makes it easier for me to measure the overall performance of the physicians. Our principle was that, we wanted to provide high quality care, and, evidence-based high quality care. So we're a network of hospitals and medical centers. And, while we may be doing it as close to possible, in the flagship facility, we want to make sure that that standard is replicated in each of our facilities. And it was really with this trying to standardize the care, not only in a specific hospital, but across a healthcare system, across various geographies, both in India as well as overseas, which becomes even more challenging because of availability of medications and things like that. But it was really this problem that we faced that we said, okay, we need to have a system that really helps us to standardize the care. And that was why we started on this journey in terms of how can we improve healthcare delivery. So whether you're visiting one of our hospitals in Trivandrum or in the northern part of Kerala, that you're going to get the same standard of care delivered to you for whatever condition that you may have. Medicine is changing. I mean, what we learned 10 years ago, even 5 years ago, and how we practice is different because of availability of new medical technology, the availability of new gold standards in diagnosis, and the availability of new medication. So unless we really practice evidence-based medicine, we are not, working in the best interest of our patients. We're not providing them the highest level of care possible. So I think as physicians, we need to look at continuously improving ourselves. So it doesn't end at med school. It doesn't end at residency. It's a continuous process of medical education or professional education that we need to abide by, and that becomes challenging, and I think that's where solutions like UpToDate is very helpful. I probably started using UpToDate perhaps soon after my residency, so late 90s, early 2000s. I can't remember exactly when, and I found it to be a great solution because all of those new practices which are being published in various journals, that information becomes available in more of a concise summary way. And so for me, it was more of a practical usage in terms of, when I did my clinical research. So I could, very quickly look up a condition, look up a medication, and get the answers that I'm, that I need. So very quickly, all those little textbooks went away, and this became the primary solution that I was using. And at that time in Boston, my hospital subscribed to UpToDate. And then for a period of time, they decided to go away from UpToDate, and actually all the physicians kind of revolted to that because they all found it to be an exceptional solution, and so our hospital ended up getting it back. And so when I moved from the States out here to the Middle East, and so I made it a point that we were going to provide up-to-date across our healthcare system. So now both in India as well as the Middle East, we provide up-to-date, across 24 facilities, free of charge to all of our healthcare providers, be they doctors or nurses or other paramedical staff. And I think, all of them find it a valuable resource that they're able to access the information that's pertinent to their patient very quickly. So I think it's been very, a helpful tool for all of us. We make it available. We encourage physicians to use it. They have to use it. So there has to be some effort on the part of the healthcare organization, as well as the physicians themselves, to take that effort in terms of, doing practicing evidence-based medicine. I'm not going to be able to force it down your throat. So it's really about, providing that resource, number one, and then secondly, the physicians themselves wanting to use that resource to improve themselves and improve patient care. Now, for me, I find it also beneficial because I maintain my medical licenses in the U.S., so I get the AMA CME credits when using up-to-date. And so it's a good reason for me to use it. So I maintain my CME credits, which are required for license renewal. Now, I don't think that same practice exists in India or in the Middle East in terms of the need to maintain a certain number of CME credits, although that is slowly changing. I know several countries that we have facilities in the Middle East have started to implement that, and perhaps that'll come about in India. And if up-to-date can also, be integrated that way in terms of CMEs for the physicians, I think they would be more encouraged to use it as well. So we just need to continuously, make our physicians aware of the extent of the resources available to them and encourage them to use it.